Let me also welcome on board Dr. B. Bhaskar Rao, the MD at KIMS Hospital, joining in on the show right now. Dr. Rao, great to have you on the show. Help us understand what's your observation on ground. Are you back to pre-COVID levels? What's happening in terms of OP as well as elective surgeries?
Yeah, thanks for inviting the comments. Definitely we have come back to the pre-COVID level, especially last time the Q4 of 21 was the real normal non-COVID patients. And compared to that, even the Q2 of this year also be totally has come back to pre-COVID level, and the number of surgeries also has increased. Those who are waiting for all these few months and they have come back. Now it has even touched more than the volume has increased because of all these waiting people as coming back towards the things. And now thanks to the vaccination and thanks to the discipline that's set in by the COVID amongst the public, with that many people are coming forward to the hospital. So our Q2 results were much better than before when compared to nearly 45% of the volume has increased, and then income has increased, and EBITDA has gone up to 54% in the half yearly if you look into that. So the quarter to quarter, even the first quarter of this year was mainly the COVID driven, and the occupancy was a little more because of the COVID, and the payer mix was also different. Now the Q2 was normalized and not much of a COVID. Then the pre-COVID level, we come back to all the normal surgeries, everything, including the transplants, all these things, and that has helped us to build this quarter.
Okay. So are you hinting at an improvement in your average revenue per operating bed because it declined on a sequential basis? Can it come back to pre-COVID levels, and can we see the margin trajectory as well better on from here?
The margins, when we look into the pre-COVID levels, the Q4 of 21 was the normal quarter. When you compare to that one, definitely there is an improvement in 15% of revenue has increased in the volume income, and 28% of the EBITDA has been increased. But if you look into the quarter to quarter, first quarter to second quarter, first quarter of this year is totally driven by COVID. So the volume and as well as the number of complicated cases, staying a longer period of time in the hospital, the expenditure and all. Now that is the reason when compared to Q1 to Q2, a slight decrease, but it is much better than the Q4, which was the normal quarter in the last year. And it will sustain moving forward. We are very confident that I hope there will not be any third wave with all the precautions what we have taken, and it will sustain and even getting better and better in the quarter to quarter, because we have taken few consultants that has been improved, and then the heart and lung continuously do the better job, and also mother and child has picked up, and that is also doing much better. So with all these three things, I think definitely moving forward, there is a great improvement when compared to this quarter.
Good morning, Dr. Rao. So just taking forward from that point, because you just brought up mother and child, we've been hearing about how private hospitals will also have to play a big role in children's vaccination. They've had to do it for the adults anyway. Anything on ground that is happening? Have consultations started?
May start now. The mother and the vaccination, now the government is approving, and the vaccination drive is going to start maybe very soon. And we are all geared up, and we are not sure whether the government is going to do entirely on them, or it is going to give a private public partnership, or they want to give it entirely to the private. So we need to wait and see. The moment when it comes, we are all geared up. If they can give an opportunity for the private people also to participate, we have been geared up in all our 12 hospitals. If the government wants to do like what the adult program they are doing, and for them, if any support we required from my side to give to the government, we are happy to do that.
Fair point. So let's now just move on. And Aisha did ask you about this, but just building on further for anything that the markets and investor community can look forward to. Margins in the quarter gone by came in at 32%. Likely to stay in this range, or you think it'll improve as people come back more for elective procedures, get more comfortable coming back?
No, it's definitely, as on today, the quarter is the normal quarter. We have done much better than the previous quarter, which was a normal quarter. When compared to the previous quarter, that is quarter one in 22, there was a very high that was due to that entire quarter was driven by COVID patients, because the payer mix was so high. As we were mentioning, in COVID, mostly the cash and insurance patients. The rest of the corporates and all will not able to get into this. That's why it was driven very high. But quarter two is totally normalized. The COVID patients are very, very minimal. I don't say that it is totally zero. There is some contribution from the COVID, but the non-COVID work has increased drastically by especially the small surgeries who are pending for a long period of time. They have come back. All the heart surgeries, transplants, everything has come back. Now moving forward also, we will sustain the same thing what we've been achieved this quarter too.
Okay, we're going to leave it at that. Dr. Rao, thank you so much for joining us today live on the market. Look forward